About contraception and birth control. Contraception is the prevention of pregnancy. Contraception, or birth control, also allows couples to plan the timing of pregnancy. Some methods can also protect against infections. Choosing a particular method of birth control depends on many factors, including a woman's overall health, age, frequency of sexual activity, number of sexual partners, desire to have children in the future, and family medical history. Individuals should work with their healthcare provider to choose a method that is best for them. It is also important to discuss birth control methods with one's sexual partner. General methods of contraception include: barrier, physically interferes with conception by keeping the egg and sperm apart. Hormonal, regulates ovulation by changing the balance of hormones related to development and release of the egg. Changes cervical mucus to impair sperm function or transport. IUDs, small devices inserted into the uterus that change the conditions in the cervix and uterus to prevent pregnancy as well as inhibiting the transit of sperm from the cervix to the fallopian tubes. Sterilization, surgical procedures that make a woman permanently unable to get pregnant and a man unable to get a woman pregnant. Some forms of birth control combine methods, such as IUDs that also release hormones. Some types of birth control may carry serious risks for some individuals. For specific information about birth control, individuals should talk to their healthcare providers. How effective is contraception? Different methods of contraception have different rates of effectiveness in preventing pregnancy. Contraception is most effective when used correctly and consistently. The failure rate increases if a method of contraception is used incorrectly or inconsistently. Only male and female condoms are effective at reducing the spread of STDs. For details about the effectiveness of specific methods of contraception, as well as potential side effects and risks, visit the website of the U.S. Department of Health and Human Services, HHS, Office on Women's Health. Can contraception reduce the risk of getting an infection? Only condoms have been proven to reduce the risk of getting some STDs. According to the HHS Office on Women's Health, the male latex condom is the best method for protecting against STDs, including HIV, AIDS. 1 Polyurethane condoms are an effective alternative if either partner has a latex allergy. Natural, lambskin condoms do not prevent the spread of STDs because of the presence of tiny pores, holes, that may allow viruses such as HIV, hepatitis B, and herpes to spread. The female condom has properties similar to the male condom, but researchers have not studied its effectiveness in reducing the spread of STDs as much as they have studied the male condom. The most common STD is the human papilloma, pronounced pap-a-lo-mu, virus, or HPV. No method of contraception can fully prevent the transmission of HPV, because it can infect areas not covered by a condom. However, using a condom with every sex act can lower the risk of transmission. If you have questions about birth control and STDs, talk to your healthcare provider. If you think you may have an STD, you should see your healthcare provider. NICHD provides additional information on the symptoms and treatment of STDs. Thanks for watching. Please subscribe.